Now we're going to continue through the exam process. Our next section is printing. So again, we can click the continue or the print, and we're taken to our print patient reports and protocols screen. You can see here we have three main sections. First section is which protocols we want to print. Second section is patient reports, and the third section is any notes on the exam. Also on this screen we have other previous patient reports for this patient, and if you want to see it, you can click right there and view what their last patient report looked like. Let's start with the protocols. Now the protocols that we have set as our default for each of these will show up. If we don't want to print a protocol, we can uncheck it. If we don't want to print any, we can uncheck them both. We can also change this to any other protocol that we have. So if this patient has any special needs that they need to use a different protocol completely, you can just pick a different one. Or if you want to use your default protocol but modified slightly, you can click on Customize. And when you click on the Customize, only the case type that they are will come up. And just like in the protocol setup, we can come in here and change any of these. We can add visits, we can remove procedures, add procedures, whatever we want to do. When we're finished, say we change this, we click Save Custom Protocol, and then we close the window. We now see this has been renamed to Case Type 2 with the date. Now this protocol is specific to this patient. We only changed it for this patient this one time. We didn't change it in our protocol defaults. Now when we print it, this customized protocol will come out. That way you can quickly tweak your protocols for specific patient needs. Down here in our patient reports, what defaults to print is the short report for each essentially module that you made a diagnosis. So we made a diagnosis for all three of the exams so that they are checked to print. If we want to print the long report, we just click these, and also the fact sheet, and we'll look at what those are in just a second. So we're going to choose to print everything right now, and you can add notes down here if you would like. We go over here to click print, and now the system is going to generate a PDF report. The more we print, the longer it's going to take to generate. It's a lot of data when you choose to print everything, so it might take a few seconds. And here we have our periodontal protocols. You can see the patient's name, date of birth, and exam date are up top. Their case type is here, and the protocol we used is right here. And here is the breakdown of each of our visits. Procedure costs are listed down here. You enter those in, so these are controlled by you. So we have each of our visits, what's going to happen. Then there's a total down here. You can use this just as you can ballpark what things are going to cost. Patients do not typically get to see protocol here. You can choose to do that, but this is pretty much for your front desk person to enter into your practice software. And next is our caries protocol. The caries protocols are different than the perio. They're not broken up by visits. They're just categorized. Down here it starts into our patient reports. So this is the section that our patients actually get and take home with them. See at the top it is customized to your office, your information. Here again we have the patient's name and the exam date. And this section right here has login information for the myhealthreport.info website. So they get a username and a unique password so they can do a secure login. And this kind of summarizes what this report is. Starts off right here with saying what their concerns were. And then we move into the short report. It gives a quick rundown of their results. And they get a health grade. So based on our diagnosis, Mr. Barnes here got a bad health grade. It tells a little bit about the oral systemic connection, what you can do, what your results mean. This is just a really short, compressed report. Then we get into the full report. Again, it has a health grade, but it lists out every one of the risk factors with a short explanation of each one next to it. And then there's a summary of treatment recommendations. And here we have our fact sheet. This is the same for every patient. This page does not change. It is customized to you, but if you want to educate your patients on what periodontal disease is, you can give them this fact sheet. Just gives them some facts. Now we move into the caries short report. Again, it gives them a risk level. That was your diagnosis, and shows it here again in graphic format. Explanation of what caries and tooth decay are and what they can do, what the results mean. We get into the long report, very similar to the periodontal report. We see each of the risk factors listed out with an explanation of each one and a summary of treatment recommendations divided into home care and professional care. And then a fact sheet describes the demineralization, remineralization process, and mouth chemistry. The oral cancer short report is very short, just says they have elevated risk, tells a little bit about oral cancer. And then the long report. This long report for oral cancer is a little different than the other two. On the long report, every risk factor is actually listed out. Only the ones they have the check mark, but we really want patients to know what risk factors are for oral cancer. As we talked about before in the exam, if some people don't want to answer certain questions in the exam, say about sexual practices or HPV positive or excessive alcohol, they don't have to answer those. Even if they don't get marked on the exam, they are listed so that people can read and see that they are a risk factor. Then summary of treatment recommendations, what you recommended for them, and then a fact sheet. So that is our patient reports. When you bring up the patient reports, you print it from the PDF viewer. So you just go up, click the printer icon, print it out on your printer. You can also save it as a PDF in here. When you are finished, click the back arrow in your browser. Do not close the window. If you close the window, you've just logged yourself out of the software. So now we're back on this screen. If everything was good, we liked the report, we printed it, then we're done. We can click New Exam. If for some reason we decided we don't need the protocols and we don't need the oral cancer, let's say we don't need the oral cancer at all, and we just want the short report on caries, we can change that. Click the print button again, and we'll see what the new report looks like. It's a lot shorter. Here we have the long perio and the caries short, and that's it. So if we like that better, we can click the print, then the back arrow. We come back here, click New Exam. So that is the last step of the exam process.